Appearing as a special guest on Dr. Gina Sam's weekly health segment, Dr. Alan Stewart, a leading minimally invasive cardiac surgeon with appointments at institutions including Mount Sinai Health System and Columbia University Medical Center, delivered a sobering but practical message that heart disease, diabetes, and obesity are largely preventable. Dr. Stewart, who has treated high-profile patients including former U.S. President Bill Clinton, used the platform to outline how everyday lifestyle choices are silently shaping long-term health outcomes.
Coronary artery disease, diabetes, and obesity intertwine with one another, and they amplify each other's damage for decades. These three problems are the leading causes of death and really poor health worldwide. The American Heart Association reports that cardiovascular disease is responsible for 30% of the deaths in the world, while the Centers of Disease Control and Prevention notes that 1 in 10 adults have diabetes and 42% of the population of the United States is considered obese. These conditions share roots in inflammation, poor diet, and inactivity, making them all very, very preventable with early action.
He emphasized that while cholesterol has long been blamed, processed sugar, poor diet, and inactivity are often the real drivers behind plaque buildup and inflammation.
Your body is like a checkbook. If you deposit more than you withdraw, your savings are going to expand, and that savings is the fat around your midsection. And more importantly than that fat around your midsection is something called visceral fat, which is the fat that's inside. It's not that belly fat that you see particularly in men, but it's that internal fat, and that's metabolically active. That's making hormones that are really making you sick. It's giving you chronic inflammation. It's giving you a feeling of poor health, the desire not to exercise and to lead a sedentary lifestyle. So these three things are kind of mixed together. And your missed opportunities are not knowing what your sugar level is because you don't go to the doctor. Sometimes you can feel hyper, sometimes you can feel a lack of energy, and oftentimes that's related to how your body is processing sugar. So when you think about these things as a vicious cycle, coronary disease and obesity and diabetes, these things trigger insulin resistance, and then chronic inflammation tends to get worse and worse over time.
One key takeaway for listeners was the importance of early self-monitoring. The surgeon encouraged the simple steps and gradual adjustments that can be made before conditions escalate into heart attacks or stroke.
First is get a tape measure. If you measure the circumference around your waist, meaning that you take the tape measure, you wrap it around your waist at its biggest point, and write that number down, and then measure your height, either centimeters or inches. And if the ratio of your waist is greater than 50% of your height, well, then you're at risk of obesity. Once you have awareness of it, there are things that you can do that don't involve taking a whole bunch of medicine. Well, eating smarter is a very easy way. Add vegetables to your servings of your meals at lunch and dinner. Gradually reduce your sugary drinks. Carbonated soda is arguably the worst thing to put in your body. Move and then move and move more. Starts with 15 minutes of walking after a meal. That's something that's found commonly in blue zones, is that people have a meal and then they go for a walk afterwards. But if we have a meal and then we sit on the couch and watch television, well, we're expending none of the energy that we've just put into our system from that high caloric meal we just had. You want to monitor trends, and the best way to do that is wearable technology, whether it's an iWatch or a Garmin or a Fitbit or a Whoop or an Oura Ring.
Dr. Stewart, author of The Heart of Longevity, said he wrote the book out of frustration after seeing patients grow sicker due to weight gain, smoking, and inactivity, all trends that accelerated after COVID-19. For St. Lucia, Where non-communicable diseases remain a growing public health concern, the segment brought international expertise into local living rooms. As Kiss FM expands its health programming with Dr. Gina Sam, the addition of a globally respected heart surgeon underscores the station's effort to connect St. Lucians with world-class medical insight. For those who missed the initial broadcast, the full interview will be rebroadcast this Sunday, March 1st, immediately following Sunday Mass with Father Albert Smith, giving listeners another opportunity to hear the life-saving advice firsthand. The core message from the broadcast: know your numbers, move more, reduce sugar, and take ownership of your health, because the decisions made today could determine the strength of your heart tomorrow. Reporting for the Hot 7 TV News, I am Jasmine Duncan.